to finish her question and then let the congressman make a response.
How do you justify your position and what qualifies you to be a better judge regarding my health care than myself? Thank you.
Thank you.
Well, let me answer your last question first. Nothing qualifies me to be a better judge for your health care than you. And one of the things that we're trying to do with this bill is to empower you to get a better health care outcome than you have right now. And one of the things, the only thing, ma'am, I was respectful of you. Please be respectful of me. All right? The only thing that empowers me to be able to take decisions based upon all 600,000 people I represent was that I was elected to do that. I was elected to sit through these hearings. I was elected to read mountains of information, analyzing what's wrong with our healthcare system and what's right, and what we need to try to provide more incentives when we're doing things right, and to make sure that rural hospitals and rural doctors and rural nurses have incentives to come and stay and work in a state like Iowa. And I'm convinced that the bill I brought here to show you today, which I have spent almost all of this year working on and thinking about and getting feedback from, I'm convinced that it's necessary, because if we do nothing, the consequences are far more severe than just taking risks that some of the things we may be putting in place might not be perfect. But if you look at what's going on in the economy right now, when you look at how much healthcare consumes of our gross domestic product, 16% now, predicted to go up to 20%, and when you look at how the cost of healthcare have tripled over the last 5 years, we've got to do something about this, or we are going to be unable to sustain a healthcare system that we all want to have in place.
That makes sense. We're ready for a question over on this side of the room. Sir.
Okay, thank you for coming, for one thing. I know there's a lot of emotion about this. I've been an ER doctor.
Can we just get your name real quick?
I'm sorry, Bob Roof, R-O-O-F, I'm from Delhi.
Great, thank you, Doctor.
I've been an ER physician for 20 years, and I have real grave concerns about government getting involved based on what I've seen. I'm going to give you one example that I've been thinking about. I know we need Medicaid as a stopgap for people that don't have coverage and have misfortunes, either a divorce or whatever, but we have, for example, we have a patient that comes to Waterloo that's on Medicaid. She was at the emergency department 92 times last year. And she's already had over 70 visits this year. She steals stuff from our department. She takes an ambulance in. Once came in wanting a pregnancy test by ambulance in the middle of the night. I have called Medicaid, I've called Human Services, and I've tried to contact a couple of you guys. No response. They just, you know, it's like, I don't think government, if they can't take care of problems we already have, how in the heck are they going to manage it?
Doctor, you and I share a very common concern about CMS and how it's functioned. And I can tell you that as Vice Chair of the Oversight Investigation Subcommittee, we have had hearings, we have called people on the carpet, and I don't know, this is the first time I'm hearing what you're talking about with this patient in Waterloo, but I can assure you that if you or somebody approaches me and my staff and provides us with documentation of the problem you just identified, we will investigate it and we will refer it for follow-up and prosecution, because what you're talking about is fraud. And I am totally committed to eliminating fraud and waste in these programs. And part of the problem is these programs have functioned for so long that you can't even get somebody on the phone at CMS to answer your questions. That's wrong, and it's broken, and we need to fix that problem. But the other problem is that you know better than anybody that right now Medicaid reimbursements are so low that a lot of physicians aren't taking Medicaid patients. And so what we're trying to do by addressing these regional problems of overutilization that drive up the cost of health care is make sure that people are going to the emergency room for the proper purpose. They're going to their primary care health care provider for the stuff that doesn't constitute emergency care, so doctors like you and the staff you work with are able to focus on the patients who have the most critical needs when they walk into the ER. And that's not happening in a lot of our hospitals around the country. They're dealing with the types of patients that you've described, and we need to do a better job of making sure that they go to the places they're supposed to.